Hello and welcome to your first aid session. So today we're going to be talking through and demonstrating the treatment for a patient that is experiencing a heart attack, also known as an MI, myocardial infarction. And this is where one or more of the coronary arteries within the heart muscle is blocked due to different factors. And this condition is known as coronary heart disease. The different factors that can cause this tend to be lifestyle, so smoking, drinking, diet, lack of exercise, hereditary reasons, also stress can have a very big impact on the heart. If somebody's having a heart attack, the signs and symptoms you may see are the colour in the face tends to become less, so they become very pale. They might be quite clammy. They might be quite anxious or stressed, or even have shortness of breath. The pain they experience tends to be in the left side of the chest, described as a crushing pain. It can radiate to different places, so down the left arm, into the shoulder, into the jaw, into the back, into the tongue. And different people have different types of heart attacks. Some people can have very, very minor symptoms. They may describe the chest pain as a twinge or an indigestion type discomfort. So if you are with somebody you think is having a heart attack, there are 3 parts to your initial treatment which are the most important. The first one is to think about your patient's position. So put them at rest, sit them down. The recommended position is the lazy W, so we sit them against a wall so they're supported, so if they do collapse or become unconscious they're not going to injure themselves further. With the knees bent up, which will take pressure off the heart, which hopefully will start to limit the deterioration to the heart. The next thing is calm reassurance, so your communication. And the way to communicate is to talk as slowly as possible. The slower you talk, the slower you'll calm their breathing rate down and then their heart rate down. And the other thing is to make sure you've called emergency services, because this is out of your scope of skill. You need further help to get the best treatment for this patient. If your patient was to collapse into an unconscious state, then go back to the beginning of your checks. So your response, airway, breathing. If they are breathing, we can put them in recovery. If they're not breathing, we're going to start CPR. 30 compressions to 2 breaths. Remembering that the new guidance during the current climate, if it's an unknown patient, we do compressions only. We continue this until further help arrives. Thank you for joining us.